So, how does cannabis interact with Suboxone? First, let's get one thing out of the way. Smoking anything is bad for you. Okay. So, that's a fact. Now, let's move on to the rest. So, when it comes to the interaction between cannabis and Suboxone, it's best to break the issue down chemically. Now, cannabis has taken a forefront in both medicinal and recreational usages. Multiple states are legalizing the plant and allowing it to be better researched for future use. But all cannabis is actually not alike. Now, cannabis, or otherwise known as marijuana, usually comes in an indica dominant or a sativa dominant strain. This usually equates to indica, helping with relaxation or pain relief, and then the sativa helping with more creativity or concentration. Now, the caveat when we look at THC percentages of each strain, over the last 10 years, THC percentages have increased from 14 to 17% to now upwards of 30 to 40% THC content. Now, THC, or tetrahydrocannabinol, is what interacts with the endocannabinoid system in our actual bodies. And because our bodies have a system that readily accepts the THC molecule, this is where things become a little bit more tricky. Now, cannabis is considered a depressant, it can be considered a stimulant, and a hallucinogen. But let's break it down. So as a depressant, cannabis can calm the central nervous system and slow brain function. This has been shown to help treat insomnia, anxiety, and muscle spasm, but it can also negatively affect response times and even attention. As a stimulant, cannabis can increase alertness, heart rate, and sometimes energy levels. This elevates moods and creativity in folks, but this also can lead to negative effects like paranoia, insomnia, and even increased anxiety. Now, lastly, cannabis can be seen as a hallucinogen. Cannabis can cause false perceptions of events or senses that cause auditory or visual hallucinations. Now, this can lead to something called psychosis, which can actually be irreversible. Now, remember when I talked about the THC percentage earlier? All of these symptoms are intensified depending on the increase of the THC content in each strain. So, when cannabis is used in conjunction with Suboxone, any or all the things that I listed can actually happen. So, more specifically, the interactions can cause CNS depression, which leads to drowsiness or confusion, alteration of Suboxone effects, which actually diminish or can increase its potency, mental health effects like anxiety, paranoia, or drastic mood changes, impaired cognition. This leads to poor memory, poor concentration, or poor decision making, actually. Cardiovascular effects like increased heart rate, blood pressure, and sometimes headaches. And then it actually can increase addictive behaviors that can interfere with overall treatment goals. Now, while cannabis has many, many positive effects, everyone's going to have a different interaction with cannabis and Suboxone. So it's always best to consult with your healthcare provider and then get more medical advice. This is especially so for any individual with a history of mental illness or a family history of mental illness, as cannabis can actually cause unwanted psychoactive effects while you take your Suboxone.